Hey guys, it's Dr. Watt from Pinecrest Chiropractic. Let's talk about one of our most common and popular demographics that we see the most of. Mamas and soon-to-be mamas. So we see so many pregnant women throughout our practice. There's a bunch of reasons for that, but one of the biggest reasons is we're Webster certified here in our office. We'll talk through what that means in just a few minutes. But let's talk about why it is so important for pregnant women to get adjusted throughout their pregnancy to make sure that they have the most successful pregnancy and the delivery that they can. One of the biggest reasons is this hormone called relaxin. Most of us has heard of this at this point, especially if you're already growing a human. And relaxin does what it sounds like it does. It helps those muscles and joints and tissues relax. That helps our pelvis move a little bit better so that when we go to give birth, that baby can pass through that canal a little bit easier. Well, relaxin doesn't just target one joint or one tissue. It attracts your whole body. Everything is then relaxed and a little bit more unstable as you progress, especially later on into your pregnancy. And so it's super important that as you are having this hormonal change to keep your body in check and moving the way it's supposed to. The other big thing is that there are huge biomechanical changes that are happening in your body at a really rapid pace. So many women are seeing changes in their core stability due to the lack of it, and then they're seeing instability within their glutes as well. Both of those things will create changes within their pelvis. Most mamas come in and have some sort of lower cross syndrome or an anterior pelvic tilt because baby is pulling them forward and they don't have the stability to counteract that. So we're seeing big changes in biomechanics happen on a weekly basis, especially once again in that third try. So as we treat you consistently throughout pregnancy, we can help your body better adapt and combat against those changes that are happening so quickly. The other thing is the most common complaints that women have while they're pregnancy. Women will complain of pelvic pain, low back pain, sciatica. Guess what? Those are three of the things that chiropractors already treat really successfully in patients who aren't pregnant. So we're pretty darn good at it in treating patients who are pregnant as well. Working on those SI joints on both sides, working through that lumbar spine, and then even keeping that sciatic nerve in check so that it's not giving you so many fits throughout this exciting time period. Let's talk about Webster technique though. This is a technique specifically developed for people with a pelvis. So mamas, that's you. It's now been geared towards mamas specifically. And as we go through Webster technique, we'll go through treating the sacrum specifically so that these SI joints will move and function like they're supposed to. We'll attack these really tight muscles, your piriformis on both sides, so that those aren't so tight. We'll work on taking pressure off the sacrotuberous ligament so that it's not putting pressure on the sciatic nerve either. All of this stuff are things that we're going to work on through Webster technique. On top of that, we're also going to work on your psoas muscle, which is one of those really tight hip flexors, and then checking your round ligament as well, which is a ligament that attaches the uterus to the front of the pelvis. By keeping all of those ligaments and muscles in check, we're going to help your uterus and pelvis grow the way they're supposed to, decreasing your symptoms, decreasing any sort of pain, and helping you progress appropriately. There's a lot at stake as you're growing a new child, and there's a lot of things going on with your body. These are things, like I said, we see every single day, and honestly, they're some of our favorite patients. So if you've got questions specifically about how chiropractic care can make changes in your pregnancy and get you feeling and functioning the best way possible, come on in, let's chat about it.